Good morning, everyone. I'm Simone Parker with CalPERS Stakeholder Relations Team, and it's a privilege to host today's event and introduce our representative to the CalPERS Board, Yvonne Walker. Before I do that, I'd like to explain the format of this meeting. Ms. Walker will provide some updates on CalPERS. Following her remarks, we will take questions as time permits. If you have questions, you can, when it comes time, you can raise your virtual hand and we will call on you. You can access this feature by clicking on the heart icon in the toolbar at the bottom of the screen and selecting the raise your hand option. Once we call on you, you can click the microphone to unmute. If you need closed captioning, even though we have an ASL interpreter, you can click the CC button on the toolbar to access that feature. This webinar is being recorded and will be posted to our YouTube page next week. If you want to automatically be notified that the video has been uploaded, you can subscribe to our YouTube channel. We have an hour today, so let's make the best use of our time. With that, I'm pleased to introduce Yvonne Walker. She's serving her first term on the board. She served California and our nation for more than 35 years, working as a union president, retirement security advocate, experienced pension fiduciary, state worker, and Marine Corps veteran. She's known for being one of California's foremost leaders in fighting for the pension and health benefits earned by our members and retirees. Please join me in welcoming Yvonne Walker.
Hey, good morning, everybody. It's good to be with you again. I just want to start out by saying, as you can see, we have an ASL interpreter. When we started, we've always been a work in progress, and it was an oversight not to have an interpreter from the beginning, but we'll continue. And if there's things, we'll continue to improve and learn and, be better. What's the saying? When you know better, you do better. And that's what we strive for all the time. Okay, so I'm just going to jump right in. It seems like I have a lot this week, and then we'll go from there. So we have a new board member this week. His name is Mike DeToy, and he was appointed by the governor to represent local governments. He's a firefighter with the city of Riverside and a member of the Hermosa Beach City Council, where he lives with his family. He's also served as a trustee on the California Firefighters Benefits Trust and a fiduciary trustee of the International Association of Firefighters Retiree Medical Trust. That was a mouthful. I had an opportunity to talk with Mike at the meeting, and I look forward to working with him as he uses his experiences as a trustee and city council member to serve us all at CalPERS. Unfortunately, you get a new member and you lose a member. Mike is replacing Lisa Middleton, who formerly held the local government seat. And I'd like to take this opportunity to thank Lisa for her service. When I first started on the board, Lisa was especially helpful to me. She mentored me. I always appreciated her measured and thoughtful comments on the issues that we were discussing. She always made it a point to put our members first, and she was a trusted partner to her fellow board members and everyone on the leadership team. I know that Lisa is going to do good things in the next chapter of her life and career, and look forward to following her there. So our board met over the last 2 days, and our investment strategy continues to be the #1 topic of discussion, given how important annual returns are in paying for the majority of retiree benefits. It is the board's responsibility to oversee these strategies to ensure they'll meet our fiduciary obligation to the members. 2025 is an especially important year for our asset liability management process, or ALM, because we always have to have acronyms. The board only takes on this process once every 4 years. And much like balancing our personal bank accounts, the ALM process takes a close look at the liabilities, meeting the costs that we are obligated to pay, and the assets we will need to cover them. For CalPERS, that means a review of our current investment strategies and updated projections of long-term pension costs. Our aim is to look for ways to improve our current strategies. This year, our Chief Investment Officer, Stephen Gilmore, is proposing a new approach, and it's one that has worked well for several institutional funds around the globe, including the New Zealand Super Fund where he came from. And rather than focusing so much on investment targets for each individual asset class, as we've done in the past, he would like us to move more the investment team's focus on what would be best for the entire portfolio. And there's evidence that annual investment returns under what he calls a total portfolio approach have consistently outperformed their investment targets. So we're eager to take a closer look at how it could work for CalPERS. So far, the board has used this process to focus on the issue of investment risk. Specifically, the board is asked to weigh in on how much risk should be taken on the way to increasing returns. Before we reach any conclusions, though, let me just say, we're focusing on learning more through sessions involving our CalPERS teams, the board's investment consultants, and outside experts. We're taking our time because we want to ensure that the board fully understands the risks and benefits of TPA. Included in our understanding, we will be having educational sessions with stakeholder groups so that we all come along this path together. I'll be honest with you, I'm excited about the path we're exploring. I think it will be better for CalPERS and our returns, and it will provide greater accountability. I'd like to share with you an analogy that was provided by one of our board consultants that I found especially helpful. And what he said was, managing the CalPERS portfolio is like planning a trip. The ultimate destination is the return objective, and the time it takes to reach that destination is like risk. In the current strategic asset allocation process, the board maps out the trip to the ultimate destination, our return target, and the time it should take, that's our risk. And by drawing out a route, setting target weights to individual asset classes. Staff are then tasked with following those directions at a specified speed. Under TPA, the board continues to set the ultimate destination and the travel time, but the staff can use a GPS that regularly adjusts the routes, the investments, based on current traffic conditions. They are not bound by a set route, the target asset class weights, but by regularly optimizing, one can save travel time and savor the extra time with friends at the destination. That's our value add return over the target. Importantly, changes to the route are communicated to keep the board apprised of the progress, just like when you call your friends to let them know when you'll be arriving. So I am sure as we go through this process, I will be sharing more about what we're doing and just let you know where we're at. But I actually am very excited that this is a path that we are considering taking. I'm going to go to healthcare now. I know how important our health benefits are for those of us that are covered by our CalPERS plans. We give our health program the same time and dedication as we do our investment work. Our priorities remain focused on managing costs, improving quality of care, ensuring access to care where members live, and equally important, ensuring members get care for their specific needs. We have two main goals to help advance our goals: the health plan contracting process and our advocacy work with state and federal agencies. In the last 2 years, our HMO and PPO contracts were negotiated for a 5-year period. For those of you with Medicare Advantage plans or family members enrolled in our basic plans, you may have noticed expanded coverage options and new health plan providers too. Most notably, our PPO contract was awarded to Blue Shield of California in tandem with Included Health. We recognize that there's some bumps in the roads. Anytime you're going through a transition, you're going to have bumps, but we're trying to address any issues as quickly as possible. But please feel free to send to our team or call into the CalPERS 800 number, and we will follow up and make sure that we're trying to smooth out the path. We also know that this year's Medicare rates were higher than usual, and that was due to changes at the federal level. I can assure you our teams will be very engaged in policy discussions about Medicare premiums for 2026. And beyond that, we're going to launch our effort to initiate the next 5-year pharmacy benefit manager contract. And given that pharmacy costs are a primary driver of overall health costs, this negotiation cycle represents an important opportunity to make meaningful change. I'll have more to report in July as we share health plan premiums for 2026. I want to take this opportunity to give a shout out to one of our members, Brian Berger. He pointed out that during our webinars, Medicare plans are a common question, and he offered some resources that are very helpful. I just want to be clear, I am not, and I don't think I should be an expert on Medicare, but I do want to be as helpful as I can. Brian recommended ordering the CalPERS publication, the Medicare Enrollment Guide, and that's up on the CalPERS website. And then also, once you get that, go to the CalPERS YouTube channel and search for the video, Understanding Your Retirement Benefit Options. He says that these two things will answer almost any question anyone has. I think that's it on that. Okay, and there have been, sorry about that, I just glitched, so I'm sorry. It happens to me too. So there have been a lot of questions about the windfall elimination provision, right? It might surprise some of you to know that not all CalPERS members have the same access to Social Security benefits during retirement. Those benefits depend on whether your employer withheld Social Security taxes from your salary. Those who didn't have the taxes withheld served in what are often called non-covered positions, with many of these being safety personnel. Okay, so prior to January 5th, these members were subject to a federal law that could reduce their Social Security benefits, known as the windfall elimination provision. The law limited benefits for anyone in a non-covered position unless they had 30 or more years of substantial earnings from a different job where Social Security taxes had been collected. I just want to point out that no matter what your work history was, Social Security has no impact on your CalPERS pension. The windfall elimination provision was repealed by the Social Security Fairness Act. It was signed into law by President Biden on January 5th. Then the new law is retroactive to benefits paid in 2024, but it is currently unclear how long it will take the Social Security Administration to fully implement the provisions of the act. And just so you know, CalPERS, we don't manage the changes brought about by the new federal law or the eventual additional payments. For that, you're going to have to contact the Social Security information for more information. And then I think that was it. And then I just want to point out, we know that there's a lot of things going on at the federal level. And I just want to assure you that our teams are monitoring every development, and we are ready to engage the appropriate lawmakers and regulatory bodies to protect the benefits that we've all earned. I would just want to encourage folks, wait, before I get to that part, I want to do things. We had a lot of questions that came in prior to the webinar. There was one that was asked a lot, are we going to have a COLA? And I will say that will be answered at the next board meeting. And then I'll report that out. So I don't have an actual answer for that. And, along with that, it was, will we have a COLA? What is the rate increase? When, so just so you know. And then there were some of them that were a little longer, and I'll just make sure that they're included in the themes of things that we send out and that you get a response, because I'm not able to do it now. So these are the updates I have for you today. To learn more about any of these topics, you can either watch our board meetings online or watch the recordings posted on our YouTube channel. And I would encourage all of you to subscribe to our YouTube channel, right? And go look at the different videos because they're really very good and they provide a lot of information. And also to go on our CalPERS website. It's a great place to find information about our benefits and the work that we're doing throughout the year. And I will say that the website was recently refreshed, but it's easier for us to find what we're looking for. In the meantime, please feel free to email me or the team with any questions you may have. And with that, I'm going to open it up for your questions.
Great. Thank you so much. So hands are starting to raise.
Okay, I
Alan,
felt like that was a lot.
you did great. Alan, if you want to come off mute, you can address Ms. Walker. It looks like he's back on mute. Renee, would you mind taking him off? There you go. There you go, Alan.
I have a question.
Yes.
When I retired, I was given an option to take my full retirement benefit or take a less benefit in the event that I pass away before my wife, which would allow my wife to continue receiving my retirement benefit.
Mm-hmm.
Does that make sense?
Yes.
Okay. How do I check to make sure that's still the way it is? I just want to confirm that that's what I did when I retired. I chose the option that I would take less in retirement with the assumption that I would pass away first, and the end result would be my wife would continue to get my full retirement until she passed away.
Right, right.
How do I confirm that?
Call into our 800 number. Call into our 800 number and just say, look, I want to confirm that I made this selection when I started my getting my benefits, and I just want to confirm that it's there so that I, have peace of mind knowing my wife will be taken care of once I'm gone.
Okay.
And Alan, I can give that to you right now if you have a pen handy.
Yeah, I do.
Okay, it's 888-225-7377.
Okay, got it. Thank you very much. And I got to tell you, this is the first time I sat in on one of these, and I've been retired a while. And it's I'm very gratified that you offered that up.
Oh yeah, well, we've been doing it. I think for about 6 months.
Yeah, okay. I think this was the first one I can recall that I, received something in an email.
I appreciate you getting on then.
Yeah. Okay. I don't want to hold anybody up. I'll lower my hand. I guess I click on.
All right. Thank you.
All right, next, Samuel.
Hey,
Hello.
Hi.
Hey, Samuel.
Hi. My question is, like the gentleman before, I picked the survivor benefit that my wife would receive the same amount upon my death. But we ended up getting a divorce, and I have tried changing my beneficiary to my new wife. And in order to do that, it's basically going to cost me almost $550 a month loss to change beneficiaries from my ex-wife to my new wife. And I don't see how that's fair or equitable, especially considering that my ex-wife is 10 years younger than my current wife.
Well, I will say, Samuel, that is an issue that has come up a lot, even before I have been on the board. And I would encourage you, because there's a much longer answer to the whys and wherefores than I can give you. But it is not a new issue. And I know that there's somebody out there looking at changing it legislatively. But
well, I mean, how did it ever? I mean, to me, if I retired 25 years ago, I mean, whatever percentage they take of my retirement earnings, whatever the pay down is, should be the same. I shouldn't be penalized 25 years later because I went through a divorce. I'm 63, and all of a sudden now my monthly income is going to change by $558 a month because I married a woman 10 years older than my ex-wife. I mean, had I stayed married, she'd get nothing would change. But because because I'm changing spouses, I have to pay $558 more a month, or don't get that much. That I don't see how that's fair or equitable or what I earned.
You know, again, Samuel, I can't answer that. I'm sure that there's a lot of factors. Like, I don't know if that was in your divorce decree that, you know, she
No,
got the X amount of, I don't know. And I don't want to get into all of that. I would just, I'm going to take down your name and your question,
okay.
and I'll have somebody get back to you because I don't have the answer for that.
Well, I've talked to everybody in the office 2 or 3 times. I've went to San Jose and sat
Okay.
down with somebody, and all I get is a shoulder shrug and go, "Well, that's just the way it is. I just push the numbers into the program, and it spits out a number and says this is all you get." No one can tell me why I'm being penalized
Yeah,
because I went through a divorce.
right there. Yeah, so I will get you a fuller answer.
Okay.
Okay.
Yeah, like I said, and then my other question would be, can I challenge that or dispute it? I mean, because like I say, just on the basis of fairness, I mean, it had nothing to do with the divorce. These are all CalPERS rules, and who makes CalPERS rules? I mean, if somebody had to decide that rather than taking 13% of my retirement to have the survivor's benefit, well, we're going to do 25% now. I mean, that's not how, when I retired, that wasn't the deal. To me, mine should be calculated on the rules and how things were when I retired, not update everything.
And I understand you feeling that way. Again, I will get somebody to answer for you fuller.
Okay. I
Okay.
appreciate it.
All right.
Thank you.
Okay.
Okay, next is R Lane. If you want to come off mute and ask your question. Go ahead, Arlene. Try one more time and then maybe we'll move on and try again. Are you there? Okay, we'll come back to you.
Wait,
And
I
we'll,
think he's on now.
yeah,
That I heard something. Oh, never mind.
okay, no problem. All right, so next we'll go to Ada. You want to come off mute?
Hi, can you hear me okay?
We
Yes,
sure
Ada.
can.
How are you doing?
I'm good. I just want to thank Yvonne for her help. In the last several months, I went to several local meetings and spoke with Yvonne, and we've had numerous emails about a long-term care issue. And I was part of a group of 135 retirees who made a choice not to continue with long-term care, but because of an error in the computer program, I was told, they thought that I was staying with long-term care. So I have received information from PERS that I am accepted into getting my refund back from the long-term care program, and I should expect a check in April. So
Oh,
Yvonne,
yay.
I want
This has been a long journey, Ada.
Yes, it has. I want to thank you. I'm glad I kept copies of everything that I turned in because evidently that's what made the difference.
Yes.
If I had not had those copies, I would have been stuck in CalPERS and that wouldn't have worked anymore for me. So thank you, Yvonne. Appreciate it.
Absolutely. And thank you for being so patient. I know it took some time and but we persevered.
Yes, thank you.
Appreciate your comments. We'll go to Jill Center next. Jill, if you want to come off mute.
Hi there. Can you hear me?
Yes, Jill.
Great. Thank you. Yvonne, I'd like to follow up on the Social Security Reform Act, and I appreciate you bringing that up because I know this is a hot topic for many. Yeah, and not just people who are going to benefit from it around California, but also friends and neighbors. The Social Security Administration has announced on its website that it's going to take up to a year to implement this, and because it's complicated and whatever. So here's my question. There's a whole group of bipartisan senators back in Washington. More and more House members are joining in to say that's not good enough. There are organizations around the entire country, union related perhaps, teachers, etc., who are also saying that's not good enough. The concern here is that there's chaos, as we all know, emanating from Washington. I'd like to know why CalPERS, as my pension fund, is not going to be raising its voice and contributing to raising its voice, to saying, no, you cannot get this lost. We want action as soon as possible, not for 1 year when it can simply be, lost in the weeds. So I'd like to know what CalPERS can do. This seems to be a fairly direct question, and it doesn't involve any extra effort because you're already keeping track of what's going on in Washington.
It does seem like a very simple question. But I will tell you, Jill, I can't speak for the board. This issue about putting a letter in to say, hey, we want this to move as quickly as possible, the board would have to do, and we direct our staff to write a letter and our lobbyists in Washington to do that. And I will certainly bring it up at the next meeting.
I'd appreciate that. Thank you.
Okay.
All right, looks like Maria, you're up next.
Hi.
Hi, Maria.
Hi. I have a question about what is the difference to retire from job and when you be doctor disability.
You want to know the difference between service retirement and disability retirement?
Yes.
Well, this is a very simplistic answer. So one, you put in whatever amount of years you have to put in to retire, the 25, 30 plus years to retire. And that's what it's based on. And then the other is your doctor, you've got an injury, doctor says you can't work anymore, you were disabled on the job, and you're able to take a disability retirement that would be sooner than a service retirement. All the different ins and outs and how it would impact you. It is different on everybody's circumstances. So in that regard, I would encourage you to either call into the 800 number or visit your local CalPERS office and sit down with someone and go over that, because it's
Okay. My point is because when I was working, they told me I need to go to apply for retirement. And I said, but I'm not retiring. And they said, yes, you need to apply for retirement. And then when the doctor said you are disability, so they will be changed your amount. I say, okay. So I do, and I'm still not working because I cannot working anything. So my amount, they come increase a little bit. And when I calling them, they say, no, that's what it is. But that's what I don't understand. What is the difference to be this doctor disability about simple retirement?
okay. So again, Maria, this is a very specific thing to you. But what I can do is to make sure that I get somebody to call you and talk it through so that they can answer your questions.
Okay, thank you.
Okay.
Thank you very much.
Thank you, Maria.
The next person, and please forgive me if I mispronounce your name, is it Harcharan? You want to come off mute? Renee, would you mind unmuting?
Hello.
We can hear you.
Okay. All right. So sorry for that. It was all right. So this is regarding the grievance process. And what happened was that let me give a little brief problem what I faced. My
Okay.
wife was having problem with sinus. She had undergone 2 operations earlier, and she was getting ready for the third. And the third operation was scheduled in UCSF. Now we went to UCSF for 6 months for prior operation, checkups and all that. And after 6 months, we were one day told, okay, now your operation is scheduled on so and so date. And we were very happy, okay, things are now getting sorted out. But immediately after 30 minutes, we received a call saying, you are not authorized for operation in this area. You are out of network. Now, we were not able to understand how they provided us all the care for 6 months. And after 6 months, now it is somehow light has shown to them that, oh, no, they are not authorized. Now, I sent a letter. First of all, I talked to their manager. They gave me the manager's number with a lot of difficulty. It was not easy to get even the number. So then I talked to him. They said, we are sorry. It is a mistake we made. We should have told you right in the beginning, you are out of network. Our doctor is out of network. And I asked them, okay, if it was out of network, how is it you have been charging me and I have been paying and I've been coming for 6 months? How is it you did not know this? Oh, no, we are sorry, sorry. All that sorry went that. But story doesn't end there. I sent a letter to the Anthem. I never received a reply from them. I sent email to the same University of San Francisco. They tried to start out delay it or send me saying, okay, you talk to so and you talk to so and so. I sent email to whosoever they told me, but I never received a reply. So it was evasion, evasion from the Anthem, evasion from the other. Only I'm happy that what happened was the doctor in the UCSF, Dr. Garola, he referred his case. He personally called to the Stanford. He said, okay, you are not in network here in the UCSF, but you are in Stanford. So the doctor there called the main
His
doctor.
colleagues
Yeah,
at Stanford.
yeah. So, and he took over and he was very kind. He said, okay, all the delay which was expected to happen, we will take care of that. So they took in time. We did not lose. So that is the positive part of it.
Oh, good.
They did the operation and she's doing well now. But
Oh, good. Glad to hear that.
but what I want to know is that it looks like the whole thing is left to the consumer, to the patient, as if he's the only person who's supposed to look after the CalPERS and the other organization, the Anthem, the provider. They we don't seem to, the patient doesn't seem to have a voice there. So there should be, I think there should be a nodal point in the CalPERS, because CalPERS is paying to all these companies. The person who's paying, should have authority to tell them. Patients should be reaching to the CalPERS, and CalPERS should in turn talk to them. They have the authority, but at the moment doesn't happen.
Did you call? I just want to make sure. Did you call into CalPERS to our 800 number?
No, there's no CalPERS number which talks about this. There's no number which says, okay, if you have a grievance, you call us. There's no grievance number.
Okay. Now I'm understanding. We have a call center, right? And so, like with problems like that, if you had called that in, then you would have been directed to somebody who could assist you. right? They take the information and everything and been directed to somebody that could have, helped facilitate or assist you.
But yeah, but that would be a general number, not the grievance number, right?
Yeah, but no, that's not a grievance number. That's not a grievance number. That's
Correct.
that's a CalPERS call center number, right? But that would
Okay.
be, I think that would have been more helpful for you than going through like trying to get with Anthem and all these different people. I'm really glad that it sounds like you had an amazing doctor who was very invested in your wife's care. So I'm glad all of that worked out. But in the
Okay,
future,
give me the number now. I would like to even follow now.
okay,
Because I'm certain, it is everything is being pounded out to the patient. You are okay. You go and look after yourself.
right.
That is
right.
my impression I'm getting, and I
Okay.
want to get down into the bottom of this. Where is the problem?
I hear that. I hear
Okay.
you that you want to get there. I think Simone's going to give you the 800 number.
Happily.
Okay, give me that.
It's 888
Okay.
225 7377.
That's the same number you give to somebody else also. Okay. All right. This is
Yes,
fine.
yes. That is
Okay.
the
All
same
right.
number.
I'll try. Thank you very much for that.
Yeah, I just remind everybody that if you have, that's the first starting point.
Okay.
That you
All
can go.
right. All
So
right.
most things get resolved through there.
Okay. All right. Thank you.
Okay. Thank you.
Michelle Green, you're up next. If you want to come off mute and ask your question.
Well, this is Jose Merced.
Oh,
Oh, no, okay, we got two.
Okay, now I'm off. Okay, thank you. This has been wonderful. So my question relates to the windfall elimination. I'm just trying to understand that law a little bit better, in particular for my mother. So she retired in, say, 2000, and when she did apply for her Social Security benefits, they were reduced because of the amount that she gets through CalPERS. With this new law, does it entitle her at this point to get more of her Social Security, or does it only apply to if you get a windfall of money where it's not impacting your Social Security? That's the best way I know how to ask that question.
Okay. Hey, where did your mother work, Michelle?
For the city of Compton.
Okay, and so they didn't take out Social Security taxes, I'm assuming.
Well, no, they did not. For the period that she worked there, no, they did not. However, she worked in private industry where she had Social Security taxes taken out. And then when she became of age to apply for the Social Security, she did. And of course, because of her pension or her CalPERS amount, they reduced the Social Security amount. So now her question is, would she be eligible to now get more of her Social Security because
so
of this new law?
Right.
And
So
I guess
I
that's
would
my
just-
question too.
Yeah, no, and I understand it. And the reason why I'm hesitating, because I don't want to interpret the law and interpret it wrong. So the best advice I can give you is to go on the Social Security website, call into them, or go into your local Social Security office, schedule an appointment, and sit down and let them explain it to you. This is their law, right? And I hesitate to give out bad information, and then have everybody say, "But Yvonne, you said," and this is not my area of expertise.
Okay, I understand. So because you brought up the law that it was enacted on January the 2nd, I thought we could get more information. So note taken, I will contact Social Security
The
Administration.
reason why I did bring it up is because we've had a lot of questions about it, and we've been redirecting people, back to Social Security.
Okay, thank you so much.
Okay.
all right. So Jose, it looks like you're up next. And I think you're already off it. Oh, no, you're back on mute. There you go.
Okay, I think you can hear me. Thank you, Yvonne and Simone, for being here. So my question is, I retired in 2012 from public service from a sheriff's department, and I have 29 years, 29.1 years of credit service with CalPERS. And so when I retired, I actually separated from employment about 18 months before I actually physically retired. And so when I called CalPERS, they did not explain to me very well, I mean, what the process was. I advised them that I was going to separate from employment, and 18 months before I actually could physically retire, which is at age 50. And so at that time, I had my wife's insurance. She's a teacher, so she has CalSTRS, and we have insurance through her. She's getting ready to retire, and so we're looking at options for our family insurance, and so I'm being told that I don't qualify for any CalPERS insurance because I separated more than 4 months before I actually physically retired. But they never told me that when I separated. All they told me was, you need to contact us 4 months before you actually could physically retire. And so I did that, and I am receiving full pension through CalPERS. My question is that true? And is there any way of contesting that or challenging that so that I could at least see if CalPERS insurance is going to be an option for us?
I don't know that you can contest it. I know, and this is just from my experience as a state worker, you have to retire within 180 days of leaving the service, right? Or you forfeit your medical insurance. I don't know what the rules were around for where you were a sheriff at the county that you were in. I don't know what the rules were.
Mm-hmm.
The only way that I would say to check is, again, call the 800 number, explain the situation, and they'll tell you. But there are very strict rules around, the health benefits and when you have to apply for them and everything else.
Yeah, and I wish when I called CalPERS the first time, I wish they would have told me that, because I probably would have just stuck around, that extra,
Right. No,
12 months or whatever.
Yeah.
But no one tells you those things, and so now I'm being told, oh no, you don't qualify to get CalPERS insurance because you separated from employment more than 4 months.
Yeah. So, and I was not part of that conversation. I don't know how it went. I don't know if, it was asked or not, or answered or not. But here's what I recommend to folks when you're getting ready to retire, because they do tell you, like when you reach certain milestones, right? You should call in and check and ask all your questions. But I also recommend for folks too to make appointment at their local field offices and go in and sit down with somebody, because, sometimes you have one conversation, but then as soon as you leave, something else comes back at you. And so you want to make sure that you're getting all of the best information as you go along. I don't know about you, but I know that, in the first conversation, I might miss something and think I've said it and not. I mean, for example, like when I was going through my healthcare thing, and I went with my doctor, and he was giving me my diagnosis, and then he went and said all of this stuff. And I wound up having to call him, his office the next day and said, so look, I know you said some very important things, and I only heard these 3 things. So can we go over this again, kind of thing?
Okay. All right. Well, I guess I'll have to call that 1-800 number and maybe make an appointment.
Good. Yeah.
Thank
Good
you.
luck.
Thank you very much.
Okay.
All right.
Thank you. Rosalind, you're next. Looks like you're off mute if you want to go ahead and speak. We're not hearing you if you're talking.
Rosalind?
Okay. Well, we can try to troubleshoot that one and maybe move on to the next one.
Yeah.
Is it Rain? If you want to come up, or Renee, if you want to unmute. There we go. Go ahead.
Hi, I'm in a bit of a noisy place. Hopefully you can hear me. Otherwise, I did type my question in the question and answer.
Okay.
We can hear you fine if you want to go
Okay,
ahead and
great.
ask it.
So our question is, I'm here with a friend of mine and we're retired annuitants from the Nevada County Superintendent of Schools. And recently we have been given information that we cannot substitute in our special education classes as paraeducators when someone is absent. Sick, when someone is sick. And we've been getting, my friend here, Debbie, has done a lot of contact with CalPERS and with our HR department, and we've been getting very conflicting information about this. Our HR seems to have a different interpretation. And we're calling about this because we very much would like to still be able to help in our classrooms as retired annuitants.
Because it's necessary with sickness. So I'm just going to jump in here because I've called 7 times to the 800 number. I've talked to the very head of retirement, called me and said, yes, you can sub as long as Nevada County Superintendent of Schools documents it correctly. And I said, okay, I'm clear on that. And so then I called yesterday for the last time and they said, we can't help you. Your county HR has to call us and get on the retired annuitant business partner employee line. And so can you clarify for me, also for us, can we sub as long as it's just a day here or there? We're not taking a long term. We're not doing anything like that.
So yeah, this has been an issue. Yes, you can sub. And the issue was that some of the districts were doing it under the wrong code.
Got it.
And so because they were doing it under the wrong code, they, you couldn't sub. And so they were sent information to say like, look, they can't sub under this code, but under this code, yes, you can. And so you're just miscoding it and you need to do it right. And so not all the districts have corrected what they're doing. And I know our team is, constantly trying to work through and talk with folks. And who were you represented by when you were working?
No, we're CalPERS. We were under CalPERS. Is that what you're asking?
No. What union were you at? Were you represented?
Oh yes, we were with Kelly in the union. We haven't contacted. Well, we did contact her, and she said. So,
but we're with the teachers union, right?
Teachers union.
Yeah, teachers union. Yeah.
Sorry, Kelly.
That's
you know
right,
Kelly.
Yeah, because the only reason I asked is because our other school, CSEA, they've been working, they've been working very diligently with the districts, trying to get them to do it right, and we're making progress, but it's a slow slog.
Yes, it's just incredible how many conversations I've had, and
it is a slow slog.
And I keep calling our HR department. I think you have the wrong. You just need to document it correctly. You need to use the right code. But
And they have, and I will say CalPERS has sent out to the employers the a circular saying this is what you need to do, and they
it's not that hard. I'm sorry.
I don't think so, but we're still talking. So
right, yeah, and we want to work. We know there's a big need right now in the classrooms, and the teachers want us.
I called payroll yesterday and they said, oh yeah, we hear it's really CalPERS is coming after all of us. I said, that's not true. I said, I've been on the phone. I said, you guys just have to document it correctly. And so that's been
all it is.
That's my conversation yesterday. I'm trying really hard here, but gosh, I'm getting the answer I knew I would get from you. So thank you for answering, but we'll get off now.
Okay, well, thank you guys. Good luck.
Yes, thank you.
All right.
Okay, thank you so much. We're getting close to the 12:30 hour. I was hoping that maybe you could take one question that I can ask live, if that would be okay.
Sure.
If the question is, will CalPERS be doing a compensate, or what will CalPERS be doing to compensate retirees under 65 living out of state who have to pay out of pocket for medical costs? Or would you have to pay outrageously unnecessary high premiums compared to retirees living within California? How will we be compensating us for our unusually imposed medical expenses over the past 3 years? When will out-of-state retirees under 65 have access to normal health care insurance? In other words, when will our out-of-state retirees not be required to pay for the outrageously bloated, unnecessary, expensive platinum version because we have nothing else available?
Well, there were a lot of words there. CalPERS will not be offsetting for retirees living out of state for their healthcare costs. Where we do help and try to help is in our negotiations and our rate negotiations and what's happening and what's going on, and trying to make sure that we can broaden how people get covered. But a direct offset, no, we are not able to do that,
Thank you.
unfortunately.
Would you like to maybe take one more, or do you want to wrap
Yeah,
up? We
let's
have
do one more.
7. Okay, wonderful. So it looks like Lane, you're next. Or Laney, maybe?
Can you hear me?
We
Yes,
can.
ma'am.
Oh, thank you. So my husband and I already retired. So my questions addressed specially for him. So our district covers our health insurance 5 years after we retired. So on his case, he retires in 2021 and he's still covered under our district for 5 years. However, he's turning 65 in April of this year.
April 1.
We tried to complete his form in Medicare because we were told about that before he retires, that once you're nearing to 65, you have to enroll in Medicare, and then he will still be covered under CalPERS retired plan, something like that. However, when we are trying to complete the form in Medicare, we noticed that the option that we're only allowed is to enroll him under Medicare Part B. Are we doing the right thing here, or should we contact CalPERS first and let them know that what should we do?
So I think you're doing the right thing, but also I also think that you should contact CalPERS, right? And make sure that you are doing all the right things, right? Because what you don't want to do is have a delay and the switch over. And I will say that our CalPERS team are extremely good about the switch over. It was once having been in contact with them, it was very seamless, but I will say on the Medicare side, when I was enrolling, it was a little more challenging. So I would call in and just ask, and just to make sure that you're checking all the right boxes.
Okay, we'll do that then.
Okay.
All right, thank you.
All right. Thank you, guys. I know that we've had, we have, as always, a lot more questions than we were able to get to. And so, as always, we collect them all and we try to put them in themes, because a lot of the questions are, while they might not be exactly the same, they follow the same themes, so that you can get an answer. And then we mail it out. It's normally about 2 weeks after we finish this call. If you don't want to wait, I'd recommend call the 800 number. That'll get you going quicker. I do appreciate you joining. Please subscribe to our YouTube channel and you'll get a notice of when this goes back up. And I'll look forward to speaking to you. We're in February, March, in April. Look forward to speaking to you in April. Thank you, guys.
Thank you, Ms. Walker. Bye-bye.
Bye.